Live. I'm Szenan from Center of Balance, the acupuncturist. Hi Veronica, how are you? Good morning. Welcome to Center of Balance. I'm Szenan from Center of Balance, the acupuncturist. Now, if you're on Instagram, you haven't been seeing us because the last 2 days the Instagram didn't work, but I managed to get it work today. So sorry for you're missing out for 2 days. But here you go, back to normal now. Now if you're on Facebook, as usual, please give a thumbs up and say hello to me. Okay. Then if you're on YouTube, please thumbs up as well. Or how to try join acupuncture group, right? Sure. Let me pull it out. Let's have a look. I'll get the link for you and I'll post it to you. There you go. No problem. So here is the group I just posted to you. So if you click the group, then you have to answer some question. We only allow acupuncturists to access to the group. Okay. And in the group, you can discuss any cases you want. You can ask questions, and if I see your question, then I'll give you an answer. To be honest, not every question will have the right answer, and that's not wrong or right. And I'm hoping that other people will join in to discuss the case as well. Right? I may give you some strategies, and in the group I show everyone just now. You can see we make meridian conversion or this card. I'm gonna take a picture and put on the post and show you one by one how to treat also the conditions. Like we post this one OBGYN or all infertility. So why it's good for infertility, and I'll take a live video as well. I haven't done this one. I posted already, but I haven't done the live video yet, and I'll explain why choosing those meridian. Okay, of course, if you learn local balance and you learn global balance, you get more idea why I choose those. Why Dr. Tan's use those meridian to treat, and why not other meridian, right? And why this trust? What does trust meaning? And why do we choose those points? It's from Bagua. But in the group it's a public group, so there are a lot of acupuncturists that haven't learned any balance method acupuncture yet, and not even local balance. And so I'll use another way, which means I'll explain in the easy way for you to understand why choosing those points, why choosing those meridian. And the point, there is nothing to say about the point, because the points actually come from the Gua, right? And if you really want to know how to get to those points, then you have to join the webinar, course, to be able to understand all about it. Does it make sense to you? Okay. let's start today's topic. So our topic today is about pregnancy back pain, causes and treatment. Right? Pregnancy back pain, all right? It can happen, okay? It can happen. It's commonly happen in all the trimester. All the trimester. People can get back pain as soon as they get pregnant and until the labor, we give birth. Then as soon as they, give birth and pain's gone. But some of them continuing. Some of them they don't get back pain until they give birth and after the birth and they get back pain. So if after birth they get back pain, we're not talking about this. This is normal back pain. We have to go to chronic back pain. We have to go to other reason of back pain. But today we're gonna talk about just when you get pregnant, you start to get back pain. Ever since you get back pain, or any back pain that happened during pregnancy. Okay. I remember I had one case who came to me with infertility issues. Okay. And that through acupuncture, I think within 2 months, she got pregnant. Probably within 3 months, I can't really remember. But we have the baby follow up in my clinic. So yeah, 2 or 3 months she got pregnant. When she got pregnant, and they went for a trip. They outside of our suburb, outside of our city, and they went to I think town or something like that. And and then she got a back pain. How did she get back pain? She hurt herself. She had a fall. Unfortunately, she had a fall. She had a fall that is what is pregnancy back pain, but it actually is an accident. It was great. It was lucky that she didn't get any bleeding. She didn't get any tummy pain. It's just back pain. And the back pain, I remember quite clearly. There's just in the lower back. I can't remember which side though. And go down to the buttock. So we all know that with acupuncture, when it's pregnancy, you don't do needle over this area. If you put needle, normally if your technique is when there's back pain in here, you put needle in here. That is your main technique. When it's pregnancy, you don't do this. You don't do this. Right? So in the Western side, to be honest, some of them may take painkiller, but most of them refuse painkiller. They don't want to take it. Why is that? Because they're very cautious. They worry about whether the medication, means painkiller, will cause any damage to the baby. So you don't want to do that. The same as this patient. When she came in, she can't walk. She doing this movement. we standing, right? She's doing this. She's we normally we walk like this, right? And she's just doing this. The movement is very very gentle, slow, and looks like a 90 years old person, lady, like has to, and she couldn't stand properly. And what happened? She couldn't lay down. To travel back from Taranga to here, it was worse. She had a fall, back pain, and travel from Taranga back to Hamilton. That's about an hour and a half. Sitting there is very uncomfortable for her. It was very uncomfortable. So what did I do? If you can't put needle in there, patient can lay down, and you're not going to do needle on the tummy, you see, and patient's not taking any medication, how would you help her? Is there any way to help her? Yes. If you know balance method acupuncture, that is fantastic. And G acupuncture, you know, if you're an acupuncturist, you know I do G acupuncture. And G acupuncture, Master Liu say, well, don't do G acupuncture at pregnancy. That is because it doesn't mean you can't needle at all. It's just because it's more stimulation, it's much stronger than balance better acupuncture. So he suggests not to use on pregnancy. And another reason is because in China, um, I talked about this already. It's so funny things, you know. So acupuncture came to the Western world, right? And people recognize acupuncture for pregnancy, for infertility. But in China, when you're pregnant, they recognize Chinese herbs. This is in culture already. This is in culture. In our culture, if you're pregnant, take some Chinese herbs to protect the baby, prevent miscarriage. But in the Western world, no, it's opposite. Yeah. If you're pregnant, do not take any herbs, do not take any drugs, do not take any Chinese herbs because it may harm the baby. That's what they worry about. But acupuncture, go for it. Nothing. Just go for it. You know, this is this is what it is. You know, so that therefore in China when pregnancy, they're very cautious when it comes to acupuncture. The reason I know that because when we study in China and yeah pregnancy woman, the acupuncturist need to ask this: are you pregnant? If you're not, oh no, not going to get acupuncture. Please go to get Chinese herbs. You know, they change their mind. You know, they're very cautious and patient in the practitioner. That is why one of the reasons that Dr. Liu, Master Liu had the concept, and he said, well, G acupuncture, no, don't do G acupuncture in pregnancy. But I'll tell you, balance method acupuncture, acupuncture spirit is only doing hands and legs and very safe for pregnancy treatment, for back pain in pregnancy. Okay, so be in mind in that. Will you give a lecture in infertility and how to treat it one day? Yes, I will. We're gonna talk infertility. You know, we talk about uh, miscarriage, right? Last time. Yes, and actually, a very good question, though, Monica. I'm gonna talk about pregnancy, like PCOS and endometriosis, all this thing next time. You know, we're gonna talk about we talk about infertility next time. That was my plan actually. That was my plan, and we're gonna slowly move to PCOS and endometriosis, all this potential uh, um, causes for infertility. That was my plan actually. That was my plan. Okay. Well, thank you for bringing it up. Thank you. Okay. Now, so yes, in this cases, I use only balanced method acupuncture and immediate relief. And I put it on hand, I put it on leg, some needle, and then she able to lay down and relax. And it's got better and better and better. And eventually, she got better. I can't remember how many treatment, how many weeks to get rid of all the pain for her, but it got better eventually with her uh, uh, pregnancy back pain. That was from injury. But we're going to talk about pregnancy back pain that is not from an injury today. So, what are the reasons? What are the reasons for pregnancy back pain? that is not actually causing from injury, right? Uh, Shifting the center of the gravity. Gravity. Okay. Why are we talking about gravity? We're talking about the baby. As your baby grows, okay, the center of your body's gravity moved outward. Right. So your spine and your back arch. Yeah. Here we normally have this, right? We have this. This is something. If you keep this curve in your lower back, in general, you won't get back pain. Well, that's the idea. This is a normal. But think about if you have a baby in the tummy, what are you gonna do? The baby is in here, you're gonna fall, right? The baby in here is gonna fall. You're gonna put back like this. So everything pull, go back this way. And when you go back this way, it doesn't. Normally, when you go back that way, what happened? We get the curve, right? It seems to be okay, right? But that is not the case because when baby in here, you try to go. If you relax, you're not forcing yourself back. You relax, you go forward, and when we go forward, this curve, you lose this curve in your lower back. So when this is supposed to be like this, and it goes straighter, that causing back pain. That causing back pain. Okay? So not everyone, pregnancy is a nature thing, it's not a disease. But when it causes back pain, then that become a problem. That become a problem. So we need to treat it properly. So this, because of the baby growth and your back of the spine arch actually change in the balance, right? This extra stress on the lower lumbar spine, right? Then it causes the pain. I'll tell you what. In these cases, if the woman they have stiffness or a little bit achy, they won't come for treatment because they know this is causing from the baby, and they just bear the pain. They sleep with the pain, try to manage with heat pack, right? Just manage for yoga, stretch, and it helps. Not until they're unbearable. They can't move. They have to be on the bed, and they can't get out of the bed, and they can't do anything. It's too much pain for them. Then they come from acupuncture. What we have, most of the cases done like this. If they have a little pain, they won't do anything. Yeah. They won't take any medication. You know, they probably will do pregnancy massage. Yeah, more common do pregnancy massage. Not many people know that acupuncture can help. You know, but some start searching. Oh yeah, acupuncture can help, and they come in. Okay, so yeah, so this is something with pregnancy back pain, and the other one is the other reasons weight gain. Then we talk about the causes pregnancy back pain, and then we're gonna talk about the treatment to that. Acupuncture treatment, I mean, because again, there is no treatment for pregnancy back pain in Western medicines. They'll give you drugs, painkiller, but they'll suggest you, you better not take it. The doctor suggests it in here. Tell them about, if the pain is not too bad, don't take medication. Now, this is something that's funny. When you're pregnant, when you get back pain, pregnancy back pain, and the doctor wouldn't suggest you take painkiller because they worry about the painkiller will harm the baby. But when you're not pregnant, they will give you painkiller straight away. And you too, if you get back pain or any hurt, any pain, you won't worry anything. You just take the painkiller yourself. So what is the logic actually? When the baby is there, you know it may harm the baby, so you don't want to take any medication. But when there is no baby, you don't worry that the medication harm you. You just take it straight away. It's difficult to understand this actually. You know. Yeah, but I know, uh, mom is greatest mom in the world and always worry about the baby. You know, don't want anything to harm the baby, but harm yourself is fine. This is probably something with logic, isn't it? Yeah. So you ask the question. You ask yourself if you're pregnant. If you're pregnant, you won't take any medication. Why would you take medication when you're not pregnant? You worry about the side effect for the baby. Why didn't you worry about the side effect for yourself? That's my question. Okay. Yeah, online. My wife just walked in. Didn't know I'm more live. Now, another reason is weight gain. Put on weight. Weight gain can be a healthy part of pregnancy because what? You need you eat more for the baby, right? But even a little bit you're likely to gain during those 9 or 10 months can put more stress on your back and core muscles. Okay. What the core muscle? Core muscles over here. The tummy muscle. So all this thing, you eat more, you gain weight. Now, obesity cause back pain as well because your back need to hold more uh, weight for you. Okay? You put more stress on your spine, lumbar spine, and that causes back pain. Hormones change. Okay, as your body prepares to deliver the baby, it releases hormone to loosen the ligament. Right? This is no hormone is normally going to the end of your pregnancy, right? Because if you want to, if you come to labor, it produces the hormone to loosen the ligament. Why? Because if it doesn't lose the ligament, then you can't go to labor, you can't give birth. So that's a natural thing happen. So when the ligaments start losing, it means that stabilizing your pelvic and lumbar spine start losing. It's not very stabilized. When that causing an imbalance, then your spine, the bone, it lost the balance. Then it may lead to discomfort or pain. It's because the ligament started loosening up, preparing for labor. Then the ligament attach all the spine, the bone, and the bone start to in the pelvic or in the lumbar as well. It start to loosen up. It's not staying like this. It can move easily because you prepare for the baby to go through and make much bigger space for the baby to go through to came out. So then when they stabilize in the bone, then they cause discomfort and pain. Right. So this toward to the end of the pregnancy, and some people get back pain. They don't get it straight away. Okay. So that cause pregnancy back pain too. Okay. So these are the potential causes for pregnancy back pain. Now we know, especially into the end of the pregnancy, you don't needle here, But in the beginning of the pregnancy, you may needle the tummy. You just have to explain to patient why you can needle here, because the baby is not even growing. It's just 1 or 2 months. It's very small. But I don't normally do that. If they're new to acupuncture, I don't do needle here. I don't do needle here. If they come to us for back pain treatment, but they got back pain because of acupuncture, they come for treatment, then I'll do some needle in here if I needed to. Why is that? Because they know acupuncture already. And I can, so 2 different people, and I do 2 different strategy. I may do needle in here, but I definitely won't do needle in here. No needle in here. So massage as well. Pregnancy massage, you have to get, when you go to pregnancy massage, you have to go to someone who know acupressure point, who know pregnancy massage. They can't do, wow, you have back pain, why I rub it very hard for you. That cause miscarriage. That may cause miscarriage. Okay, be in mind that. So, in acupressure point 2, this is the treatment that we're going to talk about right now. So what can you do? What can you do for back pain in pregnancy? Heat pack. It's something that you can do. Heat pack. Not very hot. You don't want to put very hot heat pack on there or hot water bottle on there. It's warm. Try warm thing and put it on top and feel whether it helps or not. Mainly the heat will help, but if it's injury, then try cold. The cold may help as well. Okay, so how do you know it helps or not? Try it out. Try it out, and your body will tell you. If you get decrease in pain with cold, you know cold help. If you get decrease in pain in hot, then you know hot help. Heat help. Right. Okay, there's just some question in here. Hi, happy day. How are you? Taufeeq, Ada Inca. Thanks for your lecture so far. Please, did you have webinar lecture on scalp acupuncture? My webinar lecture on scalp acupuncture, I do have some. I don't do it just for scalp acupuncture. I do balance method acupuncture. And the balance method acupuncture, we have scalp acupuncture and the 2. Okay, and the 2. The mainly for the scalp acupuncture is we actually use that to treat the 2 meridian, but I give you the map and the image, so the image can treat the entire body. And I also tell you how to needle that, and the needle is easy. Just get the article and needle, and you can go to needle those areas according to the image to treat the entire body. So that's one thing. And no, I haven't got one lecture or the whole lecture webinar is for scalp acupuncture, but that's in future because my plan is not in there at the moment. But in future, I'll do that as well. Veronica, do you agree people with big belly will have the same problem causing back pain? Yes, yes. Obesity, big belly will cause back pain. Yes. People gain weight, they cause back pain. Yes, not just pregnancy. Yeah, that's one of the biggest reasons too. Yeah. But I'll tell you, be careful to tell your patient about this. Why is that? Patient didn't want to hear that they are too fat. The back pain is due to obesity. Okay, you can tell them, but you can tell in the meantime you tell them the solution. You encourage them to lose weight. Tell them what you can do for them. Now, I have some patients they been pissed off from other practitioners. This is my experience. The patient with back pain or knee pain, go to the doctor. Doctor prescribe for what? Your husband say thank you. That's good, thank you. You're welcome. Um, why is that? When you tell patient on fibroid, did we do on fibroid? I think we did it on fibroid already. I did few video for fibroid actually. He listened to you more than me. Okay, that's great. Well, me and your husband is friend now. Good to know. Thank you, and so thank you to your husband. Um, right now, the reason I say that this is my experience. Okay, I have patient pays up from the doctor, it pays off from other practitioner because they've been especially the doctor and say they went to the doctor and said I have knee pain, I have lower back, and the doctor said, well, you have to lose weight. This is causing for you lose your uh, you're getting you're too heavy. You have to lose weight. That's it. It's causing from that, and the patient didn't like to hear that. Why is that? Because it's difficult for them. You're not actually giving the solution. You just tell them off. And think about it, who want to be told off? No, even me, I don't want to be told off. And I'm sure you didn't want to be told off as well. Now, this is what we do when it's this patient. I say, well, this is what we can do for you, acupuncture, blah, blah, blah. You tell the benefit of the acupuncture to help back pain, and they normally will get immediate relief. And when there's something you need to work out, you know, and whether acupuncture work for them or not, and whether uh, uh, and when it's work and how long does it last, explain to your patient, and they say, well, um, in the research, and people gain weight, that's put stress on the spine, and because when you sit down in there, you don't get your spine actually holding a lot of weight for you. Okay, when you're standing up as well, the lumbar here got a lot of weight on it, and the hip as well. So normally they get low back pain and hip pain. So tell them hip bone as well. Okay, so uh, think about if you're weak in those parts. If I keep putting weight for you, would you get more pain or less pain? More pain, right? So, and research show that losing weight does help ease back pain. And we have patients who are losing weight without treatment, they go better in the back. And that's true. So encourage them, change the diet. You don't tell them, hey, go for do exercise and lose weight. It doesn't make sense for them because they in pain, they can't do exercise. Encourage in diet, encourage in changing lifestyle. And they can do exercise when they lay down and exercise. Exercise doesn't mean you have to go for walk, go to gym and do those heavy stuff. No. Okay. So what you eat is important. First thing. Then you give them treatment, help them to relieve pain while they have pain, encourage to them to lose weight. You say that, well, if your purpose is just managing the pain, then you don't have to do that because you keep coming acupuncture, we can do that for you. But if your purpose is get rid of the pain, if your goal is get rid of the pain, then we help you with needles. And then I encourage you, I suggest you make a plan to lose weight. Is it what you want? Ask the permission. Is it something that you want? Yes, that I can help you to look at your diet, to change your diet and help you lose weight. Does it sound good? Yes. Do you want me to help you? Yes. Then tell me what you eat. Every meal, write it down. And then write it down and you tell them what you think. You give them a solution to support them to lose weight. That's what we do. Okay. Let's talk about acupuncture. The acupuncture. Happy day. You have to. You have a lot of question. I understand, and fibroid is not that easy. Okay, you need to go to like I just posted on the group, right? You can access to the group. OBGYN. This is something that I suggest you do. Yeah, this is one of the strategy. It's not the it's not the best. It's not the only strategy. Okay. So, but this, when it comes to any fertility issues, any OBGYN, any woman issues, this is something that you can do. So go to the group and get all this point, and then you can start with this point. Okay, because we haven't covered properly yet in fibroid, but I did some video about fibroid. Um, I did do that, and you go to YouTube and search all this thing. Okay, if they are losing a lot of blood and causing anemia, that you again changing diet is very important. Lifestyle is very important. Don't just rely on acupuncture, to be honest. And if you know Chinese herb, I don't know about you, and I do Chinese herb as well. Okay. And depending how bad it is, if it's very urgent, it's very big, and it's causing bleeding every day, then if you need the surgery, it may be a quick way to remove it to what? To remove not the uterus. I'm talking about remove the fibroid first. Then treat it in acupuncture. Why remove the fibroid first? Because you remove it, then it's not causing bleeding every day. Then you can go to treat it with acupuncture and Chinese herb to get rid of the rest of it to prevent it to come back. That's my suggestion. All right. If the patient want to get pregnant fast and that is something prevented, then acupuncture and Chinese herb, it may take time to may take a long time to decrease the fibroid. If the fibroid is very bad, then remove the fibroid. Surgery remove the fibroid, and that will help you patient get pregnant sooner. Okay, that will what I would, depending on your priority and your goal. And when it comes to infertility, we need to consider the age, because it's not just simple fibroid issues. The goal is get pregnant, right? Then you need to think about how old is this patient. If it's 39, 40, if you need to take about 1 year or 2 years to get rid of all the fibroid, I would suggest go for surgery, remove the fibroid, then acupuncture to help to balance the hormone and to help it conceive. Does it make sense to you? So you need to know your priority first, your goal first. You if you're 40 something, near 50, then your goal is not about pregnancy, then hey, treat it with acupuncture, treat it with Chinese herbs, depending on what is your goal. And doesn't matter what you do, changing lifestyle is very important. Okay, right? What is the treatment? We call 5 back pain. 5 back pain point over here, right? Now you know large intestine 4 not good for. You don't use large intestine 4 for pregnancy, so you don't need it. And lingual, you don't need it either. You don't need it in pregnancy. So, but they are very good for back pain. What can I do? So you needle from 1, 2, 3, 4, those 4 points, but not that one. That's one thing. Then you do 5 neck points. 1, 2, 3, 4, 5, because you can needle here, but not here. The 5 neck point, if you go that way, this is lower back. This is lower back. That can treat lower back, that can treat neck. And if you see that, if you put it that way, this can treat neck pain as well. So 5 neck point, 5 neck, 5 back point. 5 neck point can treat lower back and neck pain. 5 neck point can treat neck pain and back pain. No one tell you that. I'm here to tell you it. It's how you look at the image. And I treat patients. I mainly treat here with the pregnancy. I use 5 neck point instead of 5 back point to treat it, and it works very well. You try it and let me know whether it works or not. Okay. Then medical 12 back pain point. The medical 12 back point, it works too. 3 in over here, 3 yang over here, 3 in over here, 3 yang over here. Meridian, 1 meridian, 1 needle in each meridian. But it doesn't mean you only allowed to do 1 needle in each meridian. You can do more needle if needed. Okay, depending on the patient's conditions. Okay, then elbow and knee are what? Elbow and knee are the balancing the L2 belly button. Okay, this is it. Then remember we talk in the group. We talk about Dr. Tan medical back pain 8+1. That you can use it too. There's another strategy for you. Now, where do you get it? At the Facebook group. You can get it in the Facebook group. Okay, be sure that you join Facebook group. I'm learning the reverse on the hand for neck and back pain. Yeah. Yes. No one tell you this. This is, and Dr. Tan didn't tell us that because we didn't discuss about the pregnancy back pain. You see. So, but in reality, when you're in the clinic, that's when it comes to here, I stuck it there. This is not good for pregnancy, and you may still need it. It may have no problem, but if patient get miscarriage and they suspect that it's from the needles, and they'll come to you, what point do you use for this patient? Then if your notes, your treatment notes in there is Linggu or Hegu, then they will say, okay, that may cause from acupuncture. Oh, that's good. One of the class tell you that. That's good. No, sorry. Attended class, no one tell me about this. No. I'm here to tell you, if anyone attend my class, that we talk about this and we mention about pregnancy back, and I always tell them this: don't do it, because in the textbook it tell you this Linggu and tongues acupuncture. It tell you Linggu not for pregnancy. It tell on all the textbook large intestine 4 no for pregnancy, but large intestine 3 no problem. So this is important. Okay, so that's another strategy that I posted on our group. You can go and get it, but I'll tell you what, that had Linggu as well. The rest of the point, you can use it, but not Linggu. So you take off the Linggu point, remove the Linggu point, and the rest of the point are safe. Very safe, no problem at all. Okay. Happy Day say my experience on back pain patient came to me having a severe back pain, and I needed medical 8+1 and 5 back pain. After 3 treatments, he got right. He got rid of the back pain. Oh, good. Good to know. Yeah. Thank you for sharing. Yeah. This your experience. Happy day. Your I love your name, Happy Day. Your experience is very valuable, and thank you for sharing. And I hope you share more and more in the group about your case. To chase up every, to get everyone an idea. To encourage people to use it too. Okay, so this is a great example. This is a great example. Why I say this is a great example? Because some people want to know more, and some people want to know everything before they start acupuncture. And I'll give you all this theory. You know this theory now. You don't have to know everything to start the treatment. Good is good enough. Good is good enough. Jimmy told me, good is good enough, and I believe in it. Why? I put it in a simple way to let you know how yesterday, was it yesterday? Yeah, yesterday. I put it in a simple way to let you know how medical 8+1 can treat back pain, right? Very simple way. Then I actually explain why it treats all the back pain. Back pain and UB and GB, how those balance UB and GB in a very, very simple way. Then that's it. And the point, I know the point, you don't know why I would choose this point, is from Phua conversion. And you really need to go to learn local balance webinar, which we have a course in there. You can buy that. Then the next time that I do the global balance, then you can go to global balance and learn the theory. And then you know why we choose those points. Okay. And for now, you just try it straight away. I give you all those points. I explain to you. What are you waiting for? Just needle it. You don't have to wait. Whether it works or not, you're still thinking, oh, will it work? Will it work? I'm still questioning it. No, do not question. Needle it and find the answer. I know you have a question. Everyone have a question. Action. Take action to get the answer, whether it's right or not, whether it works or not for this patient. Take the action. The Happy Day. Happy Day has been doing a lot of whatever I say. Happy Day do it, right? Magical 8 for blood pressure. I think one of the videos you said that it works immediately for a patient. Yeah, but it doesn't mean that it works now. It will get rid of completely. No, it works mean that it works. Patient respond to the acupuncture, but it doesn't mean that we can fix it, right? So we need to discuss more about this, how to fix this problem. Always come with lifestyle, right? That's it for today. I'll see you tomorrow. Okay, tomorrow same time. I'll meet you here. Coming up to about 50 minutes today. It's supposed to be half an hour early. But thank you for engaging and giving me all this question that I can share more. Please, can you show me Dr. Tan's GB34 and level 8? I think I did a video. Because you are going to buy the local balance, right? I sent you the link yesterday. It's in the local balance webinar. I talk about this. Okay, I talk about this. You pay for it and then you get into it. GB34 and level 8 Dr. Tan's one are all in local balance. On local balance. You learn it in the web local balance webinar. Thank you for America. Thank you for being here with me. Thank you. Happy day. And that's it for today. And have a great day. Stay awesome. Bye bye.